Well, thank you very much, and thank you to my audience for tuning in. So it's interesting to think historically about who James Parkinson was and why he is immortalized with a disease that bears his name. What's interesting, this is a monograph published in 1817 in which James Parkinson, who was a practitioner in London, described 6 patients, 3 patients from his own clinical practice, and 3 people that he saw walking the streets of London in whom he thought he saw very similar symptoms to his 3 patients. In his own time, Dr. Parkinson was better known as a social reformer and as a geologist more than he was known as a physician. So this is essentially what he described as far as the motor disorder in Parkinson's disease. He said it was characterized by an involuntary tremulous motion with lessened muscular power in parts, not in action. So he was describing weakness and arresting tremor. He described the propensity to bend the trunk forward, which is the flexed posture of Parkinson's disease, and to pass from a walking to a running pace. So what he was describing was a festinating gait, which many patients with advanced Parkinson's disease have. And of course, the diagnosis of Parkinson's requires that patients should have at least 2 of the following 4 findings: tremor at rest, slowness of movement or bradykinesia, rigidity, which is an increased resistance to passive movement, and postural instability. Interestingly, Parkinson never described rigidity, and he never described the bradykinesia. But to some extent, he can be forgiven because Parkinson never actually examined his patients. In fact, nobody in his day examined patients because the neurological examination had yet to be invented. It was only many years later in Charcot's lab in the middle of the 19th century that people actually started touching patients and performing the rudiments of a neurological examination. So Parkinson's affects 1.5 million Americans. It's an estimated 3 to 4 million people worldwide with Parkinson's disease. This describes the prevalence rate of 200 per 100,000. It's relatively uncommon in young patients under 50. And as you can see, the prevalence of the disease goes up as patients age. So there are many more patients at age 80 or 85 who have Parkinson's than at age 60. And this tells us that Parkinson's is going to be an increasingly problematic area in medicine in the future, with the graying of the population and increasing numbers of patients who are reaching their 8th and 9th decade. Men tend to be somewhat more increased incidence than women, and the incidence rate is about 20. These are new cases, 20 per 100,000.